Hi, I'm Lisa Leiter here at the Mid-America Club at the Aon Center, where Crain's is holding its Physicians Breakfast. On the agenda at the moderated panel discussion, implementing the Affordable Care Act and other issues affecting practices everywhere. Before the event got underway, we sat down with the panelists to ask them what they think the biggest impact will be of Obamacare on the healthcare system, and here's some of what they had to say.
The way we deal with healthcare today is the more you do, the more you get paid. Now it's going to be what type of value you're providing to your stakeholders. Stakeholders being not just the insurance companies, but people in the community at large. Another thing that the Affordable Care Act is going to do is to force us to do things we should have done a long time ago. So things like look at our primary care supply, particularly with the elderly. We need more internal medicine specialists.
You're going to have usage go way up. You're going to have the supply of physicians continue to go down, so their demand is going to go up, and supply and demand, prices will go up, one way or another, unless the government puts extreme restrictions on payments for procedures and diagnostic procedures and therapeutic procedures.
So I think it boils down to the emphasis on quality over quantity of healthcare. And I think what that does, it leads and drives us to a more data-driven model for healthcare, where we can identify rapidly opportunities to improve quality, safety, efficiency of healthcare. But it's going to be a tough challenge. I think the road ahead is not going to be easy. It's going to require a lot of new innovations in health information systems above and beyond what we have today. And from an efficiency and cost-saving standpoint, I hope that it leads to a greater emphasis on more community-based care and preventive care.
We're going to have to focus on the best care, the best health, and the lower cost. And that really involves us totally changing the way we think about how we deliver care, because it's always been sort of a productivity model, how many patients you see, how many cases you do. And now it's not going to be that. It's going to be more based on what are the outcome of the cases. So, and even if you think about healthcare, we think about healthcare as the care that we give in hospitals and in practices and offices, but healthcare is a much broader thing, and only about 30% of the healthcare is in the traditional setting.
I think at a macro level, the Affordable Care Act is going to drive efficiency and improved quality of healthcare, forcing the delivery system to take out a lot of unnecessary costs. The health insurance exchanges, which will come live at the beginning of 2014, probably are going to be the tool that really drives that home. The more I've started to try to understand the exchanges, the more I think about Medicare Part D and the ability of beneficiaries to pick among competing products and figure out what's going to provide the most value. That's going to force delivery systems, insurers, et cetera, to create more value, or else they'll become irrelevant.